So hi everybody, really good to see you all today. As you know, we have been asking you all what are some of the things that you feel like you need some extra support in or to know more about, and mental health has been top of that list. So we thought we would kick off a series of London webinars focused on some of the things that you said that you'd like to hear more about. We'd kick off with mental health and sort of the referral pathways and some of the services and resources that are available to us here in London. So what today's about, it's about understanding some of that. We've got three presenters from statutory services, from community-based mental health services, and somebody who is working on a fantastic online resource of lots of different mental health services and resources, but what it isn't is exhaustive. There is tons and tons out there, and you know, that's a big part of your job is kind of terriering, going out and finding what those things are in your local area. This isn't about how to work with your patients today. It's about where to send them. It's about what services are going to be appropriate for the kinds of people that you might be supporting. We've got three fantastic speakers today, so we'll crack on. We've got a lot to cover. So I'd like to introduce Claire, who has been working as a clinical psychologist for 23 years and in Iampt for the last 11. She is the Iampt lead in Westminster and is going to talk to us a little bit today about kind of Iampt services and where you guys can fit in terms of what sort of referrals you could be making to Iampt. So I'll hand over to you, Claire.
Okay, thank you. I'm just going to, so can I share my slides? I think, do you need to take yours down? Does that, yeah, okay. 1 second, I'm just going to do that and hopefully. Right, okay, thank you. So hopefully everybody can see these. I have got masses of slides and I'm not going to talk to all of them. They will be shared with you, so if there's any information that you want. But I'm more, you know, I want to focus really on letting you know about NHS mental health services and what is likely to be available in your borough, with the caveat that wherever you work, there will be differences between mental health services because they're not by any means uniform. But I think it's worth sort of having an overview and thinking about what may be available, and particularly focusing on Iampt, because there is an Iampt service in every area throughout England, and therefore it will be something that you will be able to access for your patients, and it might just be helpful to think a little bit about what Iampt is and what it isn't. So the first thing I suppose is just thinking about, and I'm not going to, this is a very big question, I'm not going to spend lots of time on this, but I think that there is some question. We talk a lot about mental health problems. Mental health is of course something that we all have, and it can be good or bad and will be for all of us at different times during our lives. What we mean, I guess, and I think it's really important that we don't sort of pathologize people, that distress and difficulty is universal and happens to all of us at some point in our life, but that we know that as many as 1 in 4 people will experience some kind of mental or psychological distress that feels beyond normal for them during their lifetime. So it's really very, very common for people to experience what we might think of as mental health problems, and to need some level of support with that. And I think that the one thing that I always want to get across to people that's important is that there are treatments for these. There are good treatments, both medical and psychological, and also sort of social, that exist and are out there and can help people. And it's important knowing where we can send people. In talking about NHS services, I'm going to make the distinction between what is known as common mental health problems and what is called severe mental health problems or illness. It's not, I accept and I agree that this is not the most helpful way to divide people up, and in fact dividing people up and putting them in boxes is not always helpful in any way, but it is the way that NHS health services are organised currently, and so it's something you need to be aware aware of. So what you'll hear people talk about common mental health problems, and what is meant by that is depression or anxiety disorders that are often of sort of shorter term or recent onset. They can be extremely disabling for the person at the time, but generally most people will be functioning to some extent in their life, but there will be quite a lot of effect on what's happening to them. They will have some risk factors, and in Iampt we do see people with quite a number of risk factors, but most of these people won't be at immediate high risk of harm to self or others. And it's important to say that 90% of mental health problems are treated by the NHS in primary care. So that's by their GP and by something like an Iampt service, or maybe a counselling service. So that's the vast majority of people coming with mental health problems. What we mean by the more sort of severe end of mental health difficulties, and remember that people move between these things. It's not a box that we put people in and they're there for life. That's really important. People do move backwards and forwards. But they would be the people who possibly have longer term, frequently recurring illnesses that are at times really highly disabling for them and make it sometimes impossible for that individual to function. Doesn't mean that they're like that all the time, and it's really important to remember that, but that would be a characteristic of people. And that things are just more complex, so they will have a very complex pattern of social, clinical and biological needs that needs more specialist treatment. And some examples of this might be someone with bipolar disorder, for example, with psychosis, schizophrenia, personality disorders sometimes, and then sort of people with maybe really complex or treatment resistant presentations of other disorders. And these are people that just often need more specialist, longer term treatment, care and support. It doesn't mean that having one of those diagnoses means that for life an Iampt service isn't suitable for you, and I'll talk more about that in a minute, because that's not the case and I don't want to suggest that. But it's just when you're talking about your patients, it's helpful to think about which direction you might want to signpost people in. So I just wanted to really emphasize the importance of treatment, because we know that sometimes, unfortunately, people still have an experience that means certain groups don't get referred for treatment. And there are lots of reasons why particular groups don't get access to treatment. It may be that some groups of the population themselves avoid talking about mental health, avoid talking about to their doctor, for example, about how they're feeling psychologically. They'll talk about physical things, but not the psychological. But we also know that there are certain groups that tend not to get referred, and assumptions are made. So, for example, one of the things that we know that happens is that sometimes there's an assumption about older people that they don't make good use of therapy and that it wouldn't make any sense to them. When in actual fact, we know that older people do very well in therapy and outcome results are very good with people with CBT, for example. So there are some reasons that people don't always get access, and it's really important that we think with people about the fact that there are treatments out there, that there is support and help out there, and that people can recover, can live their life in the way that they would like to, despite having, or even sometimes with, a mental health problem. I think it's really important to what we might call normalize. So when you're talking to patients, to help them to think about the fact that these problems happen to a huge number of people. People with mental health problems very often feel alone. They feel as if they're the only person feeling this way. They feel very ashamed quite often of it. And it's really important that we help them not to feel that way. And I would also just say I'm going to talk about psychological treatments, but actually helpful treatments can be biological, they can be medication, they can be psychological treatments, they can also be social. And, I think Alex will probably cover a bit of this, but, thinking about what's the broader thing that someone needs. And this is where all of you guys come in, that this is the sort of thing that you're signposting people to. A treatment doesn't have to be a medical or psychological treatment. It could be an activity group, it could be something else that would be really helpful for people. So we need to think broadly about what's helpful. I wanted to mention quickly, because you will come across a lot of people in this category, long-term health conditions. So Iampt in the last few years has really focused on developing service specifically for people living with long-term health conditions. The reason for this is that we know that it's very, very common. It's much more common to have a mental health problem if you're also living with a long-term physical health condition. If you're living with more than one long-term health condition, the research shows you're almost guaranteed to have some mental health difficulties or anxiety about that, which is very understandable, of course. But what we know is that that distress can often make it much harder for people to manage their physical health condition. And there's really good research now which shows that if we can offer some psychological support to those people, then actually it makes it easier for them to manage their health condition, and the outcomes for their physical health are better as well as for their mental health. So really important to think about mental health when you're talking to people with long-term health conditions. So just to let you know about Iampt. So Iampt stands for Improving Access to Psychological Therapy, and this is a national program that was started in 2008. It's been an enormous advance. Personally, I would say that, wouldn't I? But I think in terms of offering evidence-based psychological therapies in primary care. Prior to Iampt starting, there were pockets of good practice. There were lots of good therapists working, but it was very patchy, and there was no sort of universal access to evidence-based psychological treatments until you got into the secondary care services and were more severely unwell. And so the aim was to really deliver evidence-based psychological therapy to people with common mental health problems. So those 90% of people who are treated in primary care. I'm going to tell you what a typical Iampt service should look like. And there is, Iampt is always very interesting. There is literally a manual for Iampt. There is a manual produced by NHS England that says this is what an Iampt service should look like. We know that not every Iampt service will look exactly like that, but I think there is a lot of uniformity, and most of them do look like this and do work in this way. So the typical sorts of things that you'd expect to see are that they should be offering extended hours, so some out of hours clinics. So in Westminster, for example, we are open from 8 AM till 8 PM, 4 days a week, so that people who are working can access evening or early morning appointments. They will offer a broad range of evidence-based treatments, and these are all based on the NICE guidelines, so the recommendations from the government body that recommends treatments and recommends what's effective. They should be open to self and professional referral, so people shouldn't have to go through their GP or another professional. They can self-refer, and actually we're finding, certainly in Westminster, that about 50 to 60% of our referrals come through this route. And most services, there will be a multitude of ways into the service, so you should be able to self-refer by email or by phone or online through a website, and also most Iampt services will take professional referrals from more or less anywhere. They are based in primary care, so they will often have some clinical space in GP practices, not always, and other community venues. And the idea is that this is close to home, locally based treatment that's easy for people to access. I will talk a little bit about the difference at the moment, because of course we're all in a whole different world due to COVID at the moment. Iampt services are expected to do outreach to groups that are often underrepresented, so BAME groups, LGBT, older people, younger people, all of those groups that don't typically tend to reach psychological services. There will be some kind of engagement and community engagement, and Iampt is very big on that, and certainly in Westminster we have a very big program that runs in this way, and that's something that certainly I would encourage you all to link into, so getting to know your local Iampt service and what is it that they do around outreach, because it can be really useful. They will also, the best practice is that perinatal patients are given priority, so that is women who are pregnant or have a young baby under 12 months should be seen immediately, and should have specific services for them. Again, it might vary, but that is the positive practice guide. And as I've said, they will also have specific services for people living with long-term physical health conditions. They should also all have provision to cater for people who do not speak English. Some services will have therapists that speak various different languages, which is great. Others will use interpreters, but there should always be provision for those people. So just to let you know the kind of things that Iampt works with, and I'm not just going to read through this, but because you'll get the slides, but you can see that it's a long list. And again, putting people in boxes is not always helpful, and we do know that most people that come to Iampt will have more than one possible diagnosis. You know, it's relatively unusual to see someone with just one problem, but what we will tend to do in Iampt is focus on treating the thing that is most distressing for the patient. So Iampt does offer brief treatment. It can be up to 20 sessions in some places, but that's still, you know, it's still a relatively brief engagement, and the treatment will be focused, and the idea will be to focus on the thing that is affecting the person's life most. And so we would always do a comprehensive assessment at the beginning when someone comes into the service and try to understand what is it we need to help them with, what do they want to change in their life. So all of these things are the types of difficulties that typically you might be seeing in people and that you might refer to Iampt for. There are some conditions that are not treated by Iampt, and I've mentioned some of these already, but generally Iampt services do not treat eating disorders where it's the primary problem. So problems with eating are one of the most common things that we see in depression, for example, or anxiety. If it isn't the primary problem, then that would absolutely be suitable for Iampt. But where someone has their sole problem is an eating disorder, then there are more specialist services that would work with those people. The other thing that there's often a bit of confusion around is Iampt will not see people where there is a primary substance or alcohol misuse. Now, what that means is that if someone's main problem is drug use or alcohol, Iampt isn't the right place for them, and there will be another service. And particularly with alcohol, this is actually quite important, because if someone is physiologically addicted to alcohol, they need specialist treatment to help them reduce that. And that's not something that can be offered in Iampt and can be clinically, you know, really contraindicated. Having said that, Iampt services should not be excluding people who use some substances or have some difficulty with alcohol. So it really does depend on whether that's the primary focus of treatment. The time when, for example, in Iampt, we would send someone to the alcohol service rather than we would see them ourselves is where we think there is a level of physiological addiction. And in order to be able to work with them, we need that person to cut down. But in order to do that safely, they need medical supervision to do so. And so we would need them to go to the alcohol service, because we can't provide that level of supervision safely within Iampt. We don't have medical personnel within Iampt. So I know that I noticed that was one of your questions, was around cannabis use. Again, it will depend on the level. So if the level of cannabis use is such that it is sort of the primary problem and is really driving other problems, then we would be referring to the local substance misuse service to help that patient cut down. We wouldn't exclude someone though just because they're a cannabis user. We'd end up excluding hundreds of people every year. If what we would ask is, we'd be asking, can that person cut down while they're in treatment? Because we know that the use of cannabis while they're in treatment is likely to reduce the efficacy of it. So we'd be working with the person to think about how they did that. But they wouldn't be automatically excluded because they're a cannabis user. The other things the other presentations that are not treated in Iampt would be someone with very complex or prolonged trauma. So that would be someone, for example, who perhaps is a victim of torture, someone who's had prolonged and very severe childhood abuse, for example. Those are the things where that's the primary focus of the work. Those would be offered in more specialist services than in Iampt, and I'll talk more about that. I think, though, it's important, as I said earlier, to think about the fact that just because someone has something like this in their history, or one of these diagnoses in their history, doesn't mean that Iampt wouldn't ever be appropriate for them. And Iampt services will think about this with you and with the GPs, for example. So it may be that you have someone who has a diagnosis of a historical diagnosis of schizophrenia, for example, and that's very, very stable. It's under control. They're very well. They've been well for many years, and they're now presenting with anxiety. And I worked with someone like this very, very recently. And actually, it may be that sometimes Iampt is then appropriate, but that would need to be a conversation that was had in terms of where is the most appropriate way for that person to be treated. Because people shouldn't be excluded just because they have, a particular label. So Iampt works on a stepped care basis, and what this means is that it's a way of making sure that each individual coming into the service gets the right treatment. So we don't offer 2 years of psychotherapy for someone with mild anxiety, for example. So what we do is initially there's an assessment, and in some services that will be called a triage, in others it will be called an assessment, but it will be offered very quickly within most Iampt services. And we will allocate to a step. And you'll hear a lot about the different steps, and I won't go into lots of detail, but basically step 1 within the Iampt model is the kind of the identification that there is a mental health problem. So that would be the GP, or it might be one of you as a link worker that identifies this. Step 2 is then within Iampt, and this is where we would offer treatment to those people with more mild to moderate presentations, and this would be a brief intervention. We'll talk more about this in a minute. Those interventions are delivered by staff that are known as psychological wellbeing practitioners. I didn't come up with that title, so don't blame me. They're known as PWPs, and they are trained in delivering short-term interventions for people with mild to moderate presentations. And then at step 3, we would be offering what you might think of as more traditional therapy. So sort of 50-minute sessions with a qualified CBT therapist or a counsellor or a psychologist, and they would be treating the more moderate to severe presentations. Steps 4 and 5 are outside of Iampt and are where there's delivery of psychological therapies for people with more severe and enduring presentations, and they're the more specialist services. So eating disorders services, specialist trauma services, psychology within CMHTs, those sorts of things would fall into steps 4 and 5. So just to let you know a little, sorry,
I feel like the man in the cloud. I'm going to give you 5 minutes.
Okay, sure.
Right.
I'm going to skip through these. So step 2, as I said, that we would intervene with very, very small packages of care, so short half-hour sessions with what's called guided self-help. And this means we give self-help information and we guide people through it. And that might be based on a course or individually. It might also be online. At step 3, all of these types of treatments are offered. And again, it would be about thinking with the person about what is most appropriate for them. And you can look through those. Just to let you know, during COVID, we are offering, almost every Iampt service is doing no face-to-face currently because of the government guidelines. We are offering all of our appointments online by telephone and video call, and actually there's really great evidence emerging that we're doing really well with that. Patients are liking it, staff are finding it easier than they expected, and actually the outcomes, we're maintaining our outcomes, so people are doing just as well. The other thing is that Iampt services are very involved in supporting our frontline NHS staff and social care staff, and obviously that's taking up some capacity. Waiting times was asked about. I can't answer this for every service. They vary massively. So you can expect in most Iampt services that people will be seen for triage and assessment very quickly. And then some forms of therapy will be available almost immediately. So in our service, there's no waiting list for step 2, for example. Waiting times for step 3 are generally longer, and I have heard everything from 2 weeks to a year. And it really does vary, and you would need to check out your local service. This is how to find your local Iampt service. So I'm going to send this. There is a link. You can go in, you put the patient's GP practice in, and it will come up with the local service. I would really encourage you, if you're not already engaged with your local Iampt service, please do talk to them. They will be able to, and they will be keen to talk to you. They are keen to get people in. They're keen to get referrals. So they will want to talk to you about what you can do and how you can work together. Just lastly, to let you know about those services in what we call secondary care, so services for people with more severe difficulties. These really, really, again, vary a lot more than Iampt across, even within London, but also outside of London. So most boroughs will have a single point of access. So for example, in Westminster, there is a single point of access as one phone number. That's not true everywhere, but it is true in a lot of places. You can find contacts for community mental health teams in your area, and if you don't already know these contacts, that's where I would start. GPs will also have a wealth of knowledge about this. Most boroughs and areas in the country have 24-hour crisis lines, but again, not by any means all of them. So it's really important to kind of find out this information. There are different types of specialist services available in different places. We're very lucky in Westminster that we're really well resourced. Other places aren't so well resourced. And there are some examples, but I will send those around. So, Leanna.
Trying to work out how to unmute myself. I was just going to say, if there's one, there was one last example that I thought would be useful to share. You were talking about how Iampt would, because they're focusing a lot, because they're trying to generate referrals at a step 2 level, they were putting a lot of effort and time into their outreach work. What sort of things can a team of link workers expect to invite an Iampt person in to further this conversation?
So yeah, so most Iampt services will have an outreach program, and obviously it'll vary, but they are, Iampt don't get enough referrals at step 2. And so they will all be doing quite a lot of work to try and reach those people, because we know that people with more mild difficulties don't tend to go to the GP about it. They often just cope until things get worse. And so we want to try and access people at that point. So we do, in Westminster, we do lots of outreach work. We work with local community groups, community centres, groups for older people, all those sorts of things. We work with church groups, we work in the local mosques, offering workshops and various different presentations around mental health. So things like, we run a mood boost course, so we run a you know, how to cope with low mood. We run groups on how to manage sleep, how to manage anxiety, all sorts of different things, exercise and mood. So lots of different groups that we can offer, and we work with local organisations to deliver those. At the moment, we're delivering them online, so over Zoom, just like this, but in normal times, we offer them face to face. So do get in touch with your local Iampt services and find out about this, because you may well have patient groups that you would like Iampt to come and work with. And it's a really good way of getting the service known about, and because people very often just don't know that it's there or that it's available for them.
I feel like this is such a valuable resource for social prescribers that are looking to do something a bit more proactive in their work. And I think we're stepping into a phase now where hopefully lots of you are going to have a bit more opportunity to do some more of that community development work. I'm going to thank you, Claire. That was so unbelievably helpful. Please don't go anywhere, because there's some questions that are in the chat box, and we'll come back to a bit of a Q&A at the end.
Sure.
But thank you so much. It's been great to hear from you. And I'm going to introduce now Alex Tamarides, who is the Chief Exec of Mind in Brent and Enfield. Is that right? And Alex has got Alex actually ran a social prescribing project about 5 years ago, bringing social prescribing into GP practices, but with a really kind of specific mental health focus. So he's got a background. But he's very passionate about social prescribing and the impact it can have in people's lives. I'm going to share. I'm really struggling with my sharing. But yeah, I'll hand over to you, Alex.
Okay. Hi, everyone. So yeah, as you can see on the screen, I'm just going to talk to you about sort of 4 different topics. What is a local mind association, or LMA as we call them for short? What do we do? How has it changed since COVID, or lockdown, as people seem to increasingly refer to it? And how can you make contact? I am not going to say, I'll try and be brief, because every time I say that, it seems to prolong what comes afterwards. But I will just get on with it. So firstly, a tiny bit about me. I've worked in mental health for just over 2 decades. I started off as an employment support worker at City and Hackney Mind and then worked out eventually I was probably much better at managing stuff than being a frontline worker. And I'm currently Chief Executive of Mind in Barnet and Mind in Enfield. I was the Chief Executive at Mind in Hammersmith and Fulham, and it's there that we set up a social prescription project, as Leanne alluded to, based in North End Road medical practice, which is a big GP practice with about a cap of about 19,000 people.
No dobre, už nerozprávaj o sebe, chlapec, rozprávaj o svojej práci.
I'm very passionate about the subject. Anyway, so starting off with what is a local mind association, essentially mind is split into two different shapes. One is national mind, and then the other are local mind associations. National Mind has worked as a service provider and campaigning organisation, but primarily campaigning and influencing. Just before the inception of the NHS, so just after the Second World War, it was set up. It's a charity, the National Mind that is, so it's independent, or as independent as any charity can be. And as I say, National Mind's primary focus is on influencing and shaping national developments, be it combating stigma as part of the Time to Change campaign or influencing government policy. You then have, dotted around the country, about 120 local mind associations. Some of them have been in existence since the 60s or earlier. Some of them, like Mind in Enfield, since 1995, and Mind in Barnet since 1985 or thereabouts. And all of these local mind associations are entirely separate organizations. It's almost like a franchise, you could say. So they all have their own boards, they all have their own governance, and they all have their own chief execs and staffing contingent, etc. But what we share is the values and ethos that National Mind has, and that's what sort of binds us all together. Now, what it does mean is that actually, in terms of what services are provided, it's not uniform. So what you might find at Mind in Barnet, and I'll get onto service provision in a minute, what you might find at Mind in Barnet or Mind in Enfield is not necessarily the same thing as you might find in Mind in Hull or Tameside and Glossop or Somerset. So they all come in different shapes and sizes. And that's not a wholly bad thing, because actually a lot of the reason for that diversity of shape and size and service provision is because they need to respond to local need. So it can reflect levels of local need and levels of existing service provision. Now, top line, what do we do? There's a model which some people like to refer to called the Biopsychosocial Model. Claire alluded to it earlier on in terms of mental health. And actually what local mind associations tend to do is provide services that address the social side of the psychosocial aspect. Although actually what has been in recent years is that local mind associations are now becoming providers of IAPT and clinical services, and therefore are increasingly becoming part of the psycho and social model components, rather the biopsychosocial model, which sort of allows me to kind of segue into a little bit more detail about what we do. But just another couple of top line things around, like, what's the point? Why does a local mind association actually exist when you do have all these wonderful NHS services? The first thing is down to, I guess, something that Claire alluded to, is that stigma actually exists. And stigma exists in all sorts of ways. It prevents people from talking about their mental health conditions, but it also prevents people from accessing statutory services because they might fear that it makes it too official. There's lots of reasons, a lot of them not necessarily true, why people don't want to access statutory or public service provision. And therefore the idea of a grassroots, independent, specialist mental health charity is is very appealing, and I would argue necessary to have as part of the choice you need when you're looking for help around mental health. The other thing about local mind associations versus any other local charity that you might have is that they are specialist organisations. They only exist to do one thing, which is to improve and bolster and make stronger or aid recovery in terms of people's mental health. And as such, every single bit of their structure, their line management, their appraisal process, their policy procedure, their building, everything is geared towards providing services that are mental health sensitive and competent. All of that adds up to a situation in which service users, as some people like to refer to them, I don't like that term, or people with mental health problems in the community, love to go to local mind associations. And they do so because we're trusted community specialists. And the other thing about being a local provider is we tend to have very, very strong links to the community. We tend to have staff that work locally, and we link up to a whole plethora of other services which can influence a person's mental health, but may not be primarily mental health specific. So such as domestic violence or Age UK charities and so on.
Alex, I'm just going to give you a few more minutes.
Good grief, how long have I been going for?
10 minutes, nearly.
Oh my, I'm so sorry.
It's all right, don't worry. It's really useful. It's great. It's really good. It's really good. It's great. It's yeah.
Okay, so what do we do? We provide, there's a huge amount of services that we provide. Everything from what used to be called day services, where people could drop in and simply get in touch with others, to things like befriending, so services which reduce loneliness, advocacy, which are services that increase people's rights and allow them to better engage with clinical services or local authority services in some ways. There are learning and education programs. We run crisis cafes. We're running a COVID bereavement service at the moment over in Barnet. We do workplace training and consultancy, employment support, peer support, hospital discharge, social prescription, counselling, and we even do run IAPT services. Generally, almost anything you can think of that improves a person's mental health that isn't based around giving them medication or more than likely a clinical intervention, we do. That's what we do. Since lockdown, what we've done, like most of the other providers, is we have switched that provision to online or telephone, but we're beginning to blend those services back into face-to-face provision, and possibly will flex out again if there's a second wave. So most things have remained the same. We've always provided counselling services, and incidentally, there is evidence to show that long-term counselling is effective for things like depression and so on. Sorry, I had to get that in, Claire. And then lastly, how do you access all of this wonderful stuff? You just have to make contact with your local mind association. Google it, you'll find there's one in your borough or one that straddles 2 boroughs, and just ring reception and you will get in touch with somebody that will be very, very happy to tell you about the services that they run. It's vital that you do so, because addressing the social components of a person's mental health is so important, and it can make the difference between recovery or sustained well-being and chronic use of services. So please do get in touch. And apologies for overrunning.
So sorry, that was really helpful. You're going to stick around for the Q&A, so it would be great to have you answer a couple of questions at the end. So any questions for Alex, start to pop those in the chat box now. I want to introduce our last speaker. Richard is a consultant psychologist and has been a consultant psychologist for 20 years and is the clinical lead at Good Thinking right now. Richard, can you share? Can you share your screen?
Yep, I will do. And just to not offend Claire, I'm actually a psychiatrist, so anything that I say,
sorry.
she can distance herself from.
None taken whatsoever.
Yeah, no, there's a good mix of people on this, aren't they? So, yeah, sorry, I can't. Somebody else is sharing, so I think you've got to stop sharing, Leanna.
Sorry, there we go.
Right, okay. So I'm going to be talking about something that I hope will be complementary to what Claire and sorry, I'm just right. Well, we've just been hearing from Mind, which is about the development of good thinking, which was a service that was developed out of the same research that led to Iampt, but recognizing partly because there are more people with needs than we can ever meet offline. And secondly, not everyone wanted those traditional services, if I can call them that. So good thinking arose out of a collaboration with Public Health England, the Mayor's Office, the councils, etc., Healthy London Partnership and NHS England, trying to provide something that met with the needs of Londoners. And I'm going to give you just a whistle-stop guided tour, because I hope this is a resource that all sorts of people can use, including yourselves, for your own self-care, because when people are stressed, even help getting a good night's sleep can make a huge difference to your mental health and well-being. And one of the messages we got from Londoners was sometimes they wanted help early on, a bit like Claire was saying around guided support, for low-level needs to stop them getting, you know, bigger and out of control, and wanting to be able to do that early. And that was a time where, of course, more and more was going online. Obviously, COVID has changed that even more. People are time poor, it's difficult to get to appointments, etc., etc. So there were lots of reasons that led us down this road. So I'm just going to give you a quick overview. This is a video. All the slides have links that when they're shared, if you click on them, it will show you, this is the background about the different Londoners' experiences wanting different types of support. And then this is what you'll find if you go to the Good Thinking page. You'll see across the top, it was developed at the early stage to support people with the common mental health problems, sort of mild to moderate perhaps in terms of severity, anxious, sleep problems, stressed, low mood. And when you click on those, that will take you through to a quiz of kind of like a decision aid that helps people think about what type of support they want. And nearly 80% of people who've come to Good Thinking want something that helps them assess themselves, is free, provides resources through free apps and other information, and that they can access it by themselves digitally. So we know that we're meeting some needs, and in fact, since COVID, 130,000 Londoners have come through. That will take you through to apps that we have had approved through the NHS Apps Library standards. So the resources that you find there have been scrutinized in terms of how safe and secure they are, as well as effectiveness. And some of them, like Be Mindful, which is a mindfulness app, gives comparable outcomes to what you would achieve using mindfulness CBT through Iampt. And what's great, I think, compared with the challenges of Iampt, is we can bring across London more resources together that give a bit more choice. Much more to go through. Some people may have.
Could you change the view? That's it. We can't see all of the slide. Basically, it's.
Oh right, okay. That's
in.
not happened before. So if I come out of slideshow, do you think that would do?
Oh no, if you go back in, maybe. Let me try and do it for my laptop.
Can you see that?
No, I'm afraid not. Let me see if I can do it from mine. What number slide were you on?
I was on the search function. Let me just close down then and come out of share. Actually, I don't seem to be in share. Have you taken that back, Leanna?
Oh gosh, sorry. This is.
So I think if someone goes back into share and then pops it back on the slideshows, but instead of launching the slideshow, if you just leave it in the view mode, and then we should be able to see all of the slide. If that's
okay.
You do that, Richard.
Do you want me to do that? Yeah, sorry about that. I didn't realise it. Oh, and I've now closed it down. Right. I don't. Can you share the slides?
Carry on talking, and I'll see if I can
Yeah.
share.
So the different ways of finding resources, and actually it takes us back to the whole challenge of what we would call choice architecture, which is if you go to Google, you're often overwhelmed by information. And so one of the things that good thinking hopefully captures, again, linked to all the evidence and research that Claire made reference to, I think you can go a few more forward. Two back. This is like a game show, isn't it? Right. Right. Yeah, there's a search function you can see at the top, so you can type anxiety, low mood, COVID, whatever it is, and then you'll get to a range of content from information through to apps, through to worksheets that I'll come on to. We recognize that when people go online, they don't self-define or necessarily are just struggling with mild to moderate difficulties. They may be in crisis, and particularly for people who have accessed support elsewhere, they're sometimes looking for something different, etc. So we've built in urgent support, and actually for all the boroughs across London, we've got the links to the mental health trusts and crisis lines for you. So if you go into, you'll see the Shout Crisis and Samaritans and Papyrus, but below that, there is a link to all the crisis lines across London. If we go to the next slide, there's a comprehensive self-assessment that is rigorous and covers physical as well as mental health. So for people who have had pre-existing problems, they can self-assess, or people who can privately and anonymously start to think about what they're struggling with. These self-assessments are a way of doing that. You can also, this came up in a question, this also can be carried out for you about someone else. So if a partner or a family member was struggling with something and you wanted to understand that better, you can do any one of these 4 assessments and a comprehensive general self-assessment that will give you some sort of idea of what the problem might be and what they're struggling with and what you should do. If we go to the next one. We've also developed a coronavirus section, which has lots and lots of information related to COVID, from podcasts and other relatable blogs through to very practical how-to guides and information on areas like for parents with young people who are struggling with mental health problems. And very live for us at the moment is the whole challenge of easing of lockdown. So we've been talking, if we go to the next slide, to experts at the Maudsley, where Claire will soon be. Tracy Taylor from the National OCD Service worked with us on a question that came from the student room. If you know it, a young person was talking about the challenges of going outside, the pressure to meet up with friends when still feeling very anxious. And so we're collaborating with experts across London to try and give that sort of Q&A relatable content that will help people think through, as well as practical tips of what they can do next. And this is all online 24/7, and people access this at 850 people in April and May went to Good Thinking at 3 o'clock in the morning and 3,000 at 6 o'clock in the morning. So, you know, it's there for people once they know to go back to as they need. Next slide, I think. There is a great offer from our partners at Be Mindful that before the 20th of September, unlike many of the other free offers around at the moment, you get lifetime access to guided meditations. This has been particularly helpful for people trying to give up smoking, who can just use their phone, put it in a pair of headphones and kind of manage some of those cravings, some of the distress that they can't smoke at that moment to try and stay calmer. So there's some great free offers like that, but either yourself or your clients sign up now, because that will give them lifetime access. Next slide. We recognize not everyone can go online. Digital exclusion is a huge challenge for COVID for all of us, I think. And we didn't want anyone to be left behind. So we've worked with the Centre for Clinical Interventions, following some of Claire's colleagues, like Ruth Dennis in West London, to make sure we've got downloadable workbooks. If you go to the next slide, Leanna. Again, all these links there, if you click on these, they'll take you through. So whether it's mindfulness, help about sleep, depression, anxiety, and particularly health anxiety for those worried about health at this time, you can download and print off these free really expert workbooks that somebody could work through. It goes a bit beyond tips to something a bit more thorough, perhaps a bit of a bridge between ourselves and what a service like Iampt can do, but very good standard of support. Next slide, please. There's also some great podcasts. I shouldn't say this because I interview all these people, but we kind of went for experts wherever. So Janet Wingrove, I just think is a national treasure. If you want to understand how mindfulness works and what you can do, listen to Janet, and she will help anyone sort of get to understand there are lots of simple things you can do to kind of disrupt worries so you don't drown in them. And the next slide, please. Similarly, Michael Farquhar is an expert, a consultant in sleep medicine, and it really does make a difference listening to Michael talk about what you can do, building those healthy habits to really improve your sleep. It's not the same as seeing a therapist in Iampt for that, but for most of us, it will point us in the right direction. And it's, you know, for people who can't, you're not good with text, you know, the podcasts are a really good way of accessing information. Next slide, I think we're nearly there. There are other things you can do. I suspect it would be helpful to give you a longer guided tour, because I think understanding what's there in the breadth and how you can offer it to people that you're working with or your family or yourself, you know, that there's lots and lots of content that could be helpful, you know, as I say, from personal stories to advice for employers, healthcare workers, etc. And I think we're there pretty much, Leanna. Thank you.
That was great. Thank you so much, Richard. I'm going to invite all of the speakers back, and I think we should start with the question that Sophie's raising about how to support people that have got, we're talking a lot about people that are somewhere in the sort of the step 2. How do we actually support people that have got more severe mental health?
So I suppose there's 2 things to say about that. One is I recognise that the vast majority of people that you see may have severe difficulties. I would slightly question it, actually. I suspect you also see a lot of people with mild problems, but they're maybe not presenting those as the first instance. So you may be seeing lots of people, for example, with sort of major physical health problems. They are very likely to also be experiencing anxiety or low mood at times, but they won't talk about it. And there is something about the language that we use in sort of not talking about mental health, not talking about sort of mental health problems, talking about stress, worry, feeling down at times, and normalizing that, because there will be a lot of people you're seeing with physical health problems who could also benefit from a step 2 intervention. You will, of course, see a lot of people with very complex difficulties. The referral routes for those people are nearly always through their GP. So most of those services won't be services that you can necessarily refer them to yourselves. So you will need to signpost and discuss with their GP, or get them to discuss with their GP. A lot of services will have single points of access where you may be able to make referrals, but they will primarily want referrals from GPs. So that would be the first. So in terms of accessing those services, it would be through the GP. And then there are always the services such as the ones that Alex were talking about, which, you know, will offer access and people can self-refer to. So it's worth checking out what services outside of the NHS are available for people in your area, as Alex was explaining.
I'm glad that you said that, because I really, you know, my feeling there is if you're supporting somebody that's got severe mental health issues, that is something the GP, that almost is a referral back to the GP. I think it's really important that you guys feel confident and feel like you have the skills to support, the skills and the knowledge to support people that have got that struggle or maybe have a diagnosis, but are managing their mental health, and your support, your interventions will help with that. But I think if you feel that somebody is in critical need of mental health interventions, then that definitely is a referral back to the GP.
And I think one of the things to say is exactly, again, what I was saying, that actually people won't always think that psychological services are for them. They won't necessarily think that that's what they need if they're presenting, for example, with a physical health problem. And actually people can take it really badly if you say, I think you've also got a mental health problem. You know, that's not going to be helpful for anyone. But most of those people could benefit from some support around managing, because living with a physical health condition, I mean, I live with one myself, it's not easy at times, and having some support can be really useful. So I think it's really important to think about that. There were a few other questions, Liana, that came up that were about Iampt. Do you want me to address?
Please do.
So,
yeah.
okay, so the first one was, someone asked, how do you refer to Iampt? It will vary, but most of them through, they will have an email referral route, they will have a telephone number, and they will have a website. So Google your local Iampt service, go through the link that I sent, and you'll find them. There may be a form that they want you to fill in. I would suggest you give them a call and ask how you refer. That's probably the easiest thing to do. And most Iampt services will make it. The idea of Iampt is to make it as easy as possible to refer into it. So it should be. I can't promise that that's the same for everybody, but you know that it should be. Somebody else mentioned that you've seen quite a lot of people who've been turned down by Iampt because they were complex and not been referred to specialist services. Unfortunately, I think one of the things, oh, sorry, can you go on mute, somebody?
They're not back up and running yet, I'm afraid.
One of the things that I think it's important to say, and unfortunately this is true, is that there are places where there are gaps in services. We know this, and it's not great, but there will be people that sort of, you know, don't fit into services. Mind do a great job very often in helping out with that, because they have services that are very open. But generally, I think if you feel someone should be offered a specialist service and they've been turned down by Iampt and that hasn't happened, then please talk to their GP, because it would be their GP that should be making those referrals. So in my service, if we turn down someone, we hold them and look after them until they are referred to whichever specialist service we think they should go to. But there are places where there will be gaps. Obviously, we know that.
Can I just say, I need to go bang on the dot with one. I just want to say one thing. Going to GPs is a good idea, but what you have to remember with GPs is that pre-COVID, their surgeries were full of literally 50 billion leaflets from even more different providers, and I think they're just swamped and overwhelmed with lots of different services. I don't think they're often not in the best place to understand what can actually look like a bit of a spaghetti bolognese of voluntary sector provision. What you need to do for that, it's not bias, it's strategically correct. Go to your local mine association and they will understand exactly what's happening on the ground. That provision for the social side of things, rather than IAPT, which is what it does is great, but it's different. So you need your connection with your GP, but you do need to find a node within the voluntary sector soup, and your best node is a local mine association.
Yeah, and I would totally agree. I'm talking more about access to secondary care NHS services, which has to go through GP. And in fact, Alex, we have Mind run our counselling service in Iampt in Westminster, so I work alongside them quite a lot.
I think you're right. What I want to reiterate to everybody is that you can go out there and find the local services that are available to you and refer onto them, and Mind obviously are a really good organisation to be looking at. There will be others. There are also online resources that you can look to, but I really want to be clear that to not take on too much of the responsibility. There is a limit to how much you guys are able to take on and support with, and definitely it's something that if you feel that you need to kind of share the burden with somebody else, then go back to your GP. Thanks for your time, Alex. I'm going to wrap up actually now. I know we haven't covered all of the questions, but
there was just one other, sorry, about updates on progress, because I think this is an issue, and I think this is an issue, Liana, that will come up for the link workers, is because Iampt services are so hot on confidentiality. Even when you refer, it sounds like some of you are having trouble getting progress reports. My advice would be contact your local Iampt service and ask to speak to one of the leads and have a conversation about that. I certainly would have a conversation with anyone in my borough about that. So please do that. Don't be afraid to ask for the support you need to support your patients. So that's what I would say.
Amazing. I think any other questions I'm going to pick up offline and send in a bit of a Q&A to everybody with the recording after the session, probably next week. If you could fill out the feedback form, I'd be really grateful. We're planning on doing more of these types of sessions. I'm hoping the next one will be on housing, and we've also got one planned on self-care. I think we all need a bit of that at the moment. And we also have, for those of you that are interested in doing the introduction to mental health, that's very kind of entry level on depression, anxiety. We will touch on things like what psychosis and is, and what might be behind some kind of spotting suicidal ideation. But it is very kind of a refresher, or very entry level. There's sessions running next Wednesday and the Wednesday after. Julie's kindly put the links in the chat, but I also will, I feel like you've received that from me a lot of times, but I will keep sending it, because it's somebody's offered it to us for free, and I think it's everybody who did it this week really found it very useful. So other than that, great to see so many of you on, and really welcome your ideas and input into how we can make the network of link workers in London a really great place for sharing information and best practice and support, essentially. So anyway, that's a big thank you from me, from everybody, and from our speakers, and look forward to seeing you on the next one. See you later, guys.